Hey everybody, it is about 7:30, 8 o'clock on the Thursday morning. I was doing some reading this morning. I want to do a quick update about what I came across this morning. I'm going to title this A Way Moving Forward. And so I usually do my reading in the morning, studying, and I actually came across an interesting article that I might flip around. I'm going to put it on social media. I guess I can't flip around when I'm recording. Okay. But basically the article looked at the cases of looking at China, like how do we do what we're doing? How do we stop this from going forward? And so it was looked at Wuhan, China, and actually looked at the number of cases. And there are about 86% of the cases went undiagnosed, which correlates with what we know here in the United States. And that was prior to the travel ban. And so what they calculated using basic statistics is if they had enacted the travel ban earlier and not delayed about a month with their data, they could have decreased the spread of the virus about 79%. Okay, that's interesting. So travel ban, stop, spread 79%. And then it also went on to talk about what they've done in South Korea, which is heavy testing. Social isolation, but then the people that are positive, actually, you get them out of the population. And so that's how the South Koreans shut this down. So based on this article that really came out, it shows us a way forward. And the way forward is we've already started part one, which is the social isolation. We're all at home right now, hanging out. I'm still working. I'm getting ready to go to work right now, actually. But doing that for 4 weeks while we ramp up the testing. If we can ramp up the testing and then get the people who look like they have this virus, the people with a fever and a respiratory tract infection, dry cough, muscle aches, systemic symptoms, respiratory tract symptoms, and a fever, which is a flu-like illness. We get those people tested and we can separate out those who actually have the COVID-19 infection, then we can have a similar outcome to what South Korea had. So what I'm encouraging people to do first and foremost is to stick with the social isolation, because that's your part right now. It's what you can do. The next thing is we need to push with our legislators, local governments. Yesterday afternoon, Richmond started their first drive-through testing center, and we need to reserve that for people who have fever, cough, respiratory symptoms. We need to push to get mass testing. And that's where people calling the legislators, emailing them on social media, just having a push. Like, we need to push this to make our government do what we need them to do, which is to don't want to say take care of us, but help us to block this. What the people can do is basically what we're doing right now, social isolation. If we get the mass testing, we can have a similar outcome to what South Korea's had. The other thing as well that this did show is that because they were lax on the travel ban, that's what actually made it spread throughout China, and then ultimately to the rest of the world, and helped us to be a pandemic. So the fortunate thing in the United States is we put our travel ban in sooner, so we don't have as much of a concern. But we need to now do the hard work of now doing aggressive testing to find out who actually has this, keep them out of the population, keep our social distancing, and the plan would be for us to have a similar outcome to what South Korea's had, where they've had not tons of deaths, they've kept it wrapped up, and their culture, things are opening back up there. China's opening back up. So right now we don't have a coherent plan here in the United States. So that's what we need to look for. So my encouragement is a way forward. There's a new published data article, and I'll try later on today or tonight to get this put on social media so those who want to look at can look at it. But which is going to be what we're doing now, and then pushing for mass testing. Again, look for that in your area. If your friends meet the criteria. Right now, the one in Richmond is very limited as far as what they're allowing people to do. But we need to push our government to say, look, if you can't handle this, how can we trust you with, talk about nationalized healthcare system. If we can't get everybody one single test, it makes me concerned. They need to prove themselves right now to us. That might not be the right way to say things, but the gist is that's part of one of the things that they need to do is provide this mass testing to keep people out of primary care clinics, to keep people out of the emergency room departments. We don't want to clog up the point is we don't want to clog up the healthcare system. We want to take these 85%, 85% of people that have this, they're going to get it ultimately, and keep them out of the system and keep them away from people. So I'll put that out there a little later on. As I come across stuff, I'll probably will do more of these really quick. I've read some of my thoughts about things I'm reading. I think this is very, very helpful because it shows us there's actually a way we can nip this in the bud if we're aggressive with it now. We've actually started the first part strong, which is the social isolation. The testing part, a little weak, but we actually have time to make up with this because everything's shut down. So you have a great day. Stay safe, stay healthy. We'll talk soon.